Hello.
Hello, everyone. We are so excited to be here to play Nurse Squad again, NCLEX edition. So we missed Meris last time. She
I know.
was super sick, and
I'm so sad.
I think Team Meris actually might have won. I was trying to remember here last time. Remember who won? I'm pretty sure it was Team Meris, but it's been a couple weeks. Anyway, so we're back to do more Nurse Squad tonight, and we're so happy for those of you who are able to join us. So, Susan, I will watch your wonderful videos even past passing my NCLEX with 85 questions. They enlighten me. Yes!
That is awesome.
We love to hear that.
That makes our day, truly. That's so exciting.
Totally. So, I'm curious how many of you guys are new to playing Nurse Squad Live and how many of you guys have done this before.
We know that there's going to be some familiar faces or at least familiar names out there because some of you guys are diehard and you're here every time and we love you for it. So if you're here for the first time, let us know. If you are a returning champion or player, let us know too.
Yeah, totally. So for those of you who are not familiar, okay, we got Barbara for the first time. Welcome. And hello to everybody else. So for those of you who are not familiar, Level Up RN, our company, we have 8 different Nurse Squad games for all of the core areas. So we have Med-Surg, Peds, Pharm, Maternity, health assessment, nutrition, psychiatric mental health, and what am I missing in Meris? Fundamentals.
Fundamentals, yes.
Okay.
Yes. Oh, CD is here.
Okay, there we go. There's some familiar names. All right, so lots of people here for the first time. Welcome. We're gonna play Nurse Squad, and it's gonna be super fun, and you're gonna get an awesome little review for the NCLEX. So in the past, sometimes we'll like focus on one subject. So we may just play pediatrics Nurse Squad, or we might just play maternity Nurse Squad. But tonight, tell them what we're doing tonight, Meris.
Tonight, we're playing the NCLEX review version, which is where we shuffle them all together so that we can review whatever comes up. So you can see we've got cards from all of the different subjects today. So we blended all 8 of our games into one, which you can do too if you're studying for NCLEX and you're like, I want to review all of this stuff. Playing it game by game is awesome if you are trying to study for your final exam, your classes, you're trying to brush up on stuff before a proctored exam. Like that's when you want to do that deep dive with one subject. But when you're ready to tackle it all, or you're trying to just review stuff on your way through nursing school, shuffling it all together, we do have instructions for different alternate gameplay styles for this game, which are when you get the game in here and it comes with the nice little how to play thing, there is a little friend here, a little QR code here that if you scan it will take you to alternate gameplay instructions, including how to play it like this for NCLEX review.
Yeah. So someone put it in the comments, I think I will buy those flashcards. I love your content, explanations, and vibe. Yes. Yay. I love that.
We love our vibe too.
Totally. So for those of you who maybe are not familiar with Level Up RN, we have a host of resources. We probably have 600 free videos on YouTube. We have our like best-selling flashcards, which are like the way to focus on the most important information you need to know for nursing school. So Meris is showing our pediatric deck.
Doing my best Vanna White here for you.
Yeah, I love it. Yeah, our flashcards are amazing and like really just help you focus in nursing school. We've got our planner. Awesome. I'm visiting my mom, so I literally have Nurse Squad.
I'll be Vanna.
Okay, you got your dose calc. Oh, there it is. Yep.
Dose calculation.
Yep. So if you are getting ready to start nursing school, or if you're in the middle of nursing school, you know you got to know your dose calculation. So we've got you covered on that.
Oh yeah.
And Tiara, I love them. They help me pass the NCLEX. Yes, that is awesome. Oh, tip of the day calendar. They just keep coming. That's our
hits
tip of the
just
day calendar.
Coming. Yes, this is our perpetual flip calendar. So you don't tear the page off, you just turn it, because it doesn't say today's Wednesday, the 28th, right? It's just June 28th. So you review it and then you move on to the next one. And then when you get to the end of the year, you flip it over and then you just go back through. And it covers all areas of nursing school. It's really awesome. And it looks really cute on your desk.
Totally. And we also have our Level Up RN membership on our website. So you can, yes. And speaking of that, we will be having a giveaway that might involve membership during this live. So we actually have 2 giveaways. We're going to do a giveaway about halfway through tonight, and then we're going to do an even bigger giveaway at the end, like towards the end of our.
And if you don't know what our membership is, my friend, you are missing out. Our membership has so much more than you would even believe. That dose calc book that I showed you, that exists on the membership in a course form, so that you can work through those questions with Cathy. You can answer the practice questions on your own. We have all of our core content videos, so all the stuff that's on YouTube without any ads, in order. It keeps your track of your progress, everything like that. We have cram courses where Cathy and I review like the most testable information on a subject. So maternity or pharmacology, we're going through, like, I have a test tomorrow, right? I'm taking the NCLEX and I want to review this stuff. We have an NCLEX review class course. We have, oh my God, we have like 1,000 NCLEX review questions ready for you.
Like over 1,000 review questions. Yeah.
There's contact hours for when you're a working nurse and you need to renew your license. There's contact hours on there. Like, it's nuts. There's so much on there, and there's so much more coming that you just like literally don't know. It's going to be amazing. So if you haven't checked out membership, you need to.
Totally. And and I think, where did I see? Oh, I love them. They help me pass NCLEX. Yes, I'm not in nursing school, but I'm a certified medical coder, and I watch every video you ladies post. Love them. Keep them coming. You got it.
Love that.
We are all about it. We're going to keep posting. I'm working through the rest of the pediatric playlist now, so that is going to be slowly coming out. So anyway, so that's a kind of, for people out there who are new, that's kind of a rundown of the kind of the resources we offer. Now, with our nurse squad game, how it's going to go tonight here. We're going to break you guys up into 2 teams, okay? Team Cathy and Team Meris. So if your handle, your username that you're logged in as starts with an A through an L, then you are Team Cathy, okay? And then if your handle starts with an M through a Z, you are Team Meris.
So tell us, it in, give me a comment right now that we can make sure we're all on the same page. What team are you on? Not whose team do you want to be on? Whose team are you on based on the sorting rules provided below? Yes, these flashcards do help for LPN courses.
Yep.
Absolutely. Everything that we talk about in these cards is important to know for LPN students. You just need to know what is your scope of practice, what are your particular state laws. So for instance, if we're talking about administering blood, you need to know that that's not for LPNs, but just in terms of preparing for your exams, absolutely.
Awesome. Okay. So everybody, okay, I got Team Cathy, Team Meris. Okay, awesome. Is everybody getting on the right team there?
Marie, you're on my team. Team Meris.
Shamati, you are, you're Team Meris. If your name starts with an S, that's M through Z, so Team Meris. It really doesn't matter what team you're on, because we're both awesome. They're both awesome teams.
True. They're great.
It is true. It's all good. Maybe we should change that one day. Maybe some people are tired of being,
That's
you
true.
know.
I get it.
We could, but really,
we're both very competitive. We both want to win.
Totally.
We both have, dark hair and glasses, so we're essentially the same person.
Cheers.
Yeah. Cheers.
Okay, so let's talk about what is in a nurse squad game. When you open it up, you have some instructions on how to play. We have our avatars here. So if you want to play as one of the members of our nurse squad, you can pick who you most relate to or aspire to. So who are you playing as tonight, Meris?
Come on, you know it's gotta be my girl Willow the Wiz. I love her. She is sassy. She is in charge. She looks like she has a handle on what's going on that unit. I love her. I want this energy. Look at the version of her leveled up. Like,
oh yeah, I love her hair. I love her hair.
Verklempt. Really. Like, she is amazing, and I love her. Yeah, so this is my girl right here.
And if you guys, for those of you who are like old timers who have the games and everything, let us know who you want to play as tonight. If there's an avatar that you like or aspire to, let us know in the comments. So you could probably guess who I'm going to play because I'm always playing with Izzy. Yeah. So yeah, I've been working out. Got done spending some time in Shenandoah National Park with my husband, and we are getting our hiking mileage up because we have a big trip in August up to Glacier National Park and Grand Tetons. And there's like a huge hike we want to do that's maybe slightly out of reach at this point, but we're working our way towards there. So
you guys are good.
All right. There. Okay. Hello, Cathy. That phone call. Okay.
So good.
The phone call between pituitary and thyroid. You like the mustache? Yeah. So for those of you who are like, what are you talking about? I do some really ridiculous skits that are educational as well. And I play different parts. The pituitary gland's like this really stressed out guy with a mustache because he's like middle management. He's got the hypothalamus sending him signals and he's sending signals out. And sometimes that doesn't work out. So anyway.
The skits are so funny.
So you can find
if you haven't seen them, you have to. They're so good. The insulin one is still my favorite. The fast acting. Oh my God, stop. So good. So good.
Yeah, no, I have to say that's my favorite too.
So funny.
Anyway, yeah, and when I watch them now, there's a part of me cringing. Like it's funny, but I'm also like, oh my God, I just put myself out there. But anyway, glad you enjoyed it. For those who have not seen the skits, check it out on YouTube or TikTok.
It's so funny.
They're actually in all the places. So
Maria passed her NCLEX.
Congratulations. That's awesome. Okay, I got sidetracked. Avatars. The other thing okay. The other thing, and then we have our question cards, okay? We have our question cards, and questions are either 1, 2, or 3 points, depending on, how hard they are. So 1 point questions are going to be a little easier, 3 point a little harder. And there's a lot of question cards per game. And there's 2 questions on each of the cards as well. So
this is med
you get
a ton.
Yeah, you have a lot of stuff to review it. And if you know Level Up RN, you know that the questions in these games are the things you have to know, and that we
are not wasting your time, but more than that, we're not wasting our own time. We don't have the time to sit here and write you a million questions about things that don't matter. You don't want that, and we don't want that either. So you can rest assured that if it is a question on here, it is because we know that is testable material. You've got to be able to do it. And a lot of times people get all mad at us because these questions are not multiple choice or even select all that apply, right? They are a prompt. They are asking you to dig deep and active recall that information, and that is by design. We didn't do that by accident. We did that on purpose, because if you can really dig deep and find that information yourself, number 1, you truly know it, and number 2, the act of recalling that information strengthens that neural pathway and makes it a stronger memory going forward. So it's on purpose, I promise.
Yeah, totally. And then the other thing that's in each of the Nurse Squad games are hazard cards, which are hilarious and awesome and super creative. So I picked out some of my favorite hazard cards to play on Team Meris tonight. Did you pick out some too?
I did.
So you don't have to play with hazard cards, But if you're playing competitively, which is what we do here, then you're going to see a lot of hazard cards being thrown in the live version of Nurse Squad.
Yeah. Oh, if Cathy and I were playing like PvP, like in real time, it would just be like hazard card central. Like we would
Totally.
raid all of the decks and like pull them all out, have all 64 hazard cards. Like it would be cutthroat. And that's what's nice about this game is that you can do everything from like collaborative, studying by myself, studying in a group, or like I'm taking you down kind of play. So
Totally.
yeah,
Totally.
whatever learner you are, you can play this game.
Totally. So when you play a hazard card on your opponent, then the next question, they have to get it right or they will lose 4 points. So if they get it wrong, they lose 4 points. If they get it right, then nothing happens. 0 points are gained, they're lost. But they managed to evade the 4-point loss. So anyway, look for us to play some of those later. What else? I think is that it?
Yeah, I think so.
So how about we get into it, guys? You guys ready to play? All right. I want to contract. Okay. All right. So I'll start with Team Meris. Let me ask you guys a question first. You guys ready? All right.
Let's go. Where's my thing? Oh, there it is. Okay.
Meris. So remember, if your handle is M through Z, this is your question. You guys have 60 seconds to answer it. This is a 2-point psych therapies question. What medication should the nurse anticipate administering to a patient experiencing benzodiazepine toxicity? What medication should the nurse anticipate administering to a patient experiencing benzodiazepine toxicity? Can you be my scorekeeper, Meris? Because I don't have my thing.
Yeah.
Okay.
I
got my mom's house.
Just keep your pile, and then let me know.
That was quick. You guys are right. Flumazenil.
Yes, flumazenil. If you are taught an antidote in nursing school, you must know it. There's lots of antidotes out there for lots of different medications, but you aren't learning all of them. You're learning a select few. If you are taught an antidote, it is a got to know it sort of a thing. So yes, even though I've never seen that given, and in fact, we actively avoid giving it in the ER because it can cause seizures, you better believe I got it in my brain forever because it's on the NCLEX.
Right. And definitely make sure you remember the difference in the antidotes for a benzo versus an opioid, right? So tell us what the antidote for an opioid analgesic would be in the comments. What is that antidote? The generic name
because
of that.
You also know that they're going to put that on as one of the possible options, right? Because you're going to see antidote and you're going to go naloxone. Exactly right.
Very
you guys are so
good.
smart. Yep. And
Totally.
But don't jump ahead. They're going to try and trick you with naloxone, right? So you are going to be very smart and you're going to look for the correct answer of flumazenil. You guys got it.
All right.
Narcan.
All right.
Yep.
Nice job, Team Meris.
All right. You ready?
All right, Team Cathy, A through L, let's go.
All right, 2-point GI question from the pediatric deck. Are we ready? What are 2 ways to decrease gastroesophageal reflux in infants and or children? What are 2 ways to decrease gastroesophageal reflux in infants or children?
Okay, so what are some things like with an infant? What could we do to try to keep that down and not coming back up, right? Their food. And then for children, there's lots of things we can do, lots of interventions we can suggest to the families of children to help prevent. Yup. So that's one. So we can make sure that our infants, children are sitting up. They're not like laying down right after eating and stuff like that. Yes. Small frequent meals. Excellent.
So you guys got it. Like you got it. But tell me about infants, like, because that's really more. All of this is kind of more children.
What can we do with infants? Like, what can we do with their formula?
Yeah,
we can burp
them after feeding. Love that. There's 2 specific things I'm thinking of related to infants in particular.
Yeah, and especially like formula-fed infants. What can we do?
A specialized formula. How is it special? Because they will ask you.
There it is. You can thicken the formula. Yep.
Yes, and you will very commonly see this referred to as rice thickened formula because it's often used as like a rice powder or rice protein. So a thickened formula. And then what if I'm a tiny baby and I can't sit up? Like what? Like I don't want to make you drink, but I do want to lead you to the water. What about that baby? What about the position that we put them in to sleep? Instead of being like this.
And for children, for that matter, too.
Yes, you will see that this will be, again, this is per order, right? We're not just doing this because the thing to do for safe sleep is on their back supine, right? Perfectly flat. However, yes, per order, they can elevate the head of the crib, right? So that that gravity is working with us, not against us. And they can keep the gastric contents down. So they might put a wedge underneath the crib mattress to elevate it. So those things would be different, but again, per order.
Totally. And for children, you could put blocks under the head of the bed or somehow elevate the head of the bed to help, again, with, gravity, keeping those contents down in the stomach. So, All right. Awesome job, guys. All right. I have Pharm 2-point nervous system question.
Bring it on. We got this.
What is the antidote for cholinergic medications?
Ooh.
What is can you hit the timer?
Oh, yeah.
What is the antidote for cholinergic medications?
Antidotes, you got to know it, right? It's not for funsies. What's the antidote to a cholinergic medication?
Atropine. Yes. There it is.
Atropine. So if I have cholinergic toxicity, then I want a strong anticholinergic, right? And when I think strong anticholinergic, I personally think atropine. If you see trope in the middle of the name, atropine, that is a strong anticholinergic. So anytime you see that trope is hanging around, you got to be thinking anticholinergic. Absolutely. You guys are so smart. So smart.
That was so quick. So quick. All right. Bring us our next question.
Oh, I'm bringing the heat a little bit with a 3-point newborn care question from the maternity deck. So,
we got
up,
this.
Baby. Here we go.
No worries. No worries. Let's go.
When caring for an infant with neonatal abstinence syndrome, NAS, how often should Finnegan screening be performed? So in an infant with neonatal abstinence syndrome, how often are we performing the Finnegan screening?
Wow, that's intense.
It's intense. It's a 3-point question.
Where's CD? Where's CD at? Where are my other?
Close. Close.
Not every 2 hours. So let's just start throwing some numbers out there, y'all. Okay, let's just go. Q4? Q1? Keep going, y'all. We might lose this one. I have zero idea.
Oh, man.
Every 30 minutes.
Man. It is tough. You're right, it's tough. No, I'm looking. Don't you worry, I'm looking.
Minutes for every 15 minutes for the first hour?
That might be right, but we would have to look that up. I don't know about the first hour. We're talking about the ongoing.
Every 24 hours, every 12 hours. Oh my God, girl.
Oh,
every shift. Did we lose?
No, you lost it, but someone from Team Meris answered it. It is every 3 hours. Yes, every 3 hours. I will look into this every 15 minutes for the first hour thing, though, because if that's the case, we need to update the card to reflect it. But yes, every 3 hours is Finnegan NAS screening. Yes. What's that?
Like Fenergan? Did you say Fenergan or Fennegan? What are we talking about?
Finnegan. Finnegan, like a dude's last name, Finnegan.
Oh, all right. Yeah, no, I got nothing on that one. I would have taken the big L on that kind of question if that had been on the NCLEX, for sure.
It was on
Okay.
mine. Yes, that one, and I remember being like, "This is wildly specific. Like, this is too much."
NCLEX. Oh my God.
Yeah, and that was when I was very confident I was passing because I was like, "I'm getting the most like insane questions of all time. Like, this must be like, you know."
That is weirdly specific stuff
Oh
right
yeah.
there.
Oh yeah. Yeah, it was
Wow.
intense.
Okay. Wow. All right. It's okay, Team Cathy. That was a really hard question. That was
It
a
was a pretty
3-point
hard
question.
question.
Yeah, that was 3 points, I'm assuming,
Yep.
right?
Yep.
Yeah,
Yep.
because that was crazy. All right, fine. Nutrition.
Ugh.
Nutrition foundation, 2 points. Oh, this one is not that hard, really. Okay. Patients taking warfarin must maintain a consistent intake of what vitamin?
Y'all better just spit that out. You should have heard warfarin and just had that answer right away. You guys know this one. I didn't even start the clock. But I don't need to. You guys know this one.
Yeah, this will come out in like 5 seconds, I'm sure. Annie said that question made me sweat. Yeah, me too. Yeah, vitamin K. Nice.
Good job.
Definitely got to know that, right? That's
Yep.
that is something you're going to get tested on a lot of different times, probably in nutrition and pharm, on the NCLEX, like everywhere.
Med surge.
So,
It's everywhere. Yeah.
totally.
Yep.
Okay, so before Maris asks the next question for Team Cathy, let's go ahead and have you guys, if you want to win a Nurse Squad game of your choice, then in the comments, only one time, only one entry per person. If you enter more than once, then Angelina will kick you out of the running. So you will not get to win Nurse Squad, okay? And if you have all the Nurse Squad but still want to enter, that's fine. And if you win, then we'll work something out, okay?
We'll make it right.
Totally. So if you want to win a Nurse Squad game of your choice, then in the comments, you will put Nurse Squad for the win. Okay?
Nurse Squad for the
Nurse
win.
Squad for the win! Exclamation point.
Exclamation point.
You have to have the exclamation point, okay? But if you already typed it in and hit enter, don't do it again, okay? Like, we're not going to kick you out. Okay. Yeah. Nurse Squad for the win. I know. I'm all about the weirdly specific things for having to win.
Yep.
Okay. For the win. Okay, great. So you guys do that. And while you guys are entering, Team Cathy, go ahead and enter the contest because you got to get ready to answer a question. Okay. I need all the brain cells on deck. Especially if we're going to get some crazy maternity question again. Oh my God.
I have to bring the crazy when it comes to maternity. Come on.
Okay. Wow. All right. So, all right, Nurse Cathy, get your entry in. Okay. We're ready. We're ready for our next question.
All right. This is a 2-point psych disorders question. Everyone's favorite. All right. Which mental health disorder places a patient at risk for detrimental behaviors such as unsafe sexual practices or impulsive spending?
Okay.
Which mental
health disorder
places a patient at risk for detrimental behaviors such as unsafe sexual practices or impulsive spending?
Okay. What mental health oh, there it is. Oh, that was so fast.
That was so
disorder. Fast. So during manic episodes, patients may make poor decisions that they will later regret. So as the nurse, we need to protect our patients when they're in our care from making those kind of poor choices when they are in a manic episode. So good. Awesome. Bipolar mania. So smart. Okay. All right. I have a 2-point maternity, which is not nearly as cray-cray as that last maternity. All right. So Team Meris, you guys ready?
So ready.
A 1 hour glucose tolerance test result greater than what level indicates the need for a follow-up 3-hour glucose tolerance test? So I'll repeat that one more time. A 1 hour glucose tolerance test result greater than what level indicates the need for a follow-up 3-hour glucose tolerance test? No, we're not there yet.
You are close.
Oh man, y'all might lose this one.
No.
How much time we got?
No, they're smart. They're gonna get it. You guys are
let
close.
me see let's see the timer.
Sarah got it. Sarah got it. Sarah got it.
Sarah got it. 140 milligrams per deciliter. That is the correct answer.
So I would say that in general, you don't need to know the numbers associated with the 3-hour glucose. The thing that you need to know is that any two of the numbers of the 3-hour glucose being out of whack is a diagnosis for gestational diabetes. For the 1 hour, though, you've got to know it. You are likely to get a question that is something along the lines of a patient who is, 29 weeks pregnant undergoes a 1 hour glucose test and receives a reading of 132. How should the nurse advise the patient, right? You're going to need to interpret that data. So yes, good job. You guys are so smart.
Yeah, no, I remember getting asked that. So you do have to know that 140. It's important. Yeah. So, okay. Do we have a winner yet or not quite yet?
I think that.
Oh, okay. All right. We do have a winner, but Angelina's like, no announcing a winner until we get more likes on this video. So if you're enjoying yourself, if you're having fun, if you're learning stuff, then make sure to hit that like button.
She is diabolical. She is holding hostage the name of our winner. I'm impressed.
Yeah. Yep. Okay. So she does know a winner, but she wants more likes first. That's how she does. All right. So hit that like button, and then we'll hopefully be able to announce the winner in the next round or two. Okay. Another nutrition.
Oh, God. Here's another nutrition question. Ugh.
Okay. All right.
Oh, this is a toughie. 2-point nutrition foundation questions. It's a toughie if you don't know these, like I don't know these. So if you actually are doing well in nutrition, you're going to get this, no problem. A deficiency of which vitamin can lead to beriberi and Wernicke-Korsakoff syndrome? A deficiency of which vitamin can lead to beriberi and Wernicke-Korsakoff syndrome?
Okay, what deficiency and what vitamin causes these disorders?
You're in the right avenue. Okay. There we go. Yes.
There it is.
Vitamin B1. Yes. Vitamin B1 in the ER is a medication that I give very frequently, because if I have a patient who comes in who has chronic alcohol abuse, right, use and abuse, then we have patients who have chronically low vitamin B1 levels. And one of the things that I give in the ER for these patients is thiamine, vitamin B1. Yes, absolutely. So got to know that. Wernicke-Korsakoff syndrome, that's where we are affecting Wernicke's area, right? And we end up with that. That's where you see those patients who have this chronic alcohol use, who have that kind of slurred speech and they're not making any sense. And you think, God, I've never been that drunk in my life. You're right, because it's not intoxication. It's a problem with the speech. So yes, absolutely. You are on it.
Nice job. Nice job. Okay. We have okay, we have a winner. Okay. And Angelia's like, I want you to say it, Cathy. That's hilarious. I don't know. Okay. Yeah. So if you guys don't know me, and a lot of you do, like you watch my videos, and not my strong suit, right, is pronouncing really difficult names, drug names, people names, whatever names. So When I say this wrong, which I will, I'm sure, then it's nothing personal. So the winner of a Nurse Squad game of your choice is La Pierre. Is it like Precious? It's like, it kind of looks like Precious. Precious. I don't know. It's spelled. Here, I'm gonna spell it.
I speak Spanish, not French.
Okay, it's PRE.
I put it in the comments. I put it in the comments for you.
What's the thing over the E? PRE with the thingy over it.
Accent.
CIEUSE. You don't have to be laughing so loud. I am sorry, but La Pierre, congratulations. And I hate that I can't pronounce people's names right because it feels super disrespectful, and I totally don't want to be disrespectful. Well, you say it. How do you say it?
I can't. That's why I said I speak Spanish, not French. Oh my God. I was in a play in high school and I had to say 2 sentences in French, and it took like 3 months to get me even like close to being able to say it right.
Okay, yeah, it's French, ladies. That's what Sarah had to say. Yeah, it's Precious in French. Okay, so can I just say La Pierre Precious? Like, is that cool or not cool? Is that not okay? Okay, here's the worst part about all of this is I actually took French in high school. I know. Flushed it all from my head afterwards. Like, and yeah, okay. You want to hear a little story? Like, okay, just slight deviation here. Like, my husband and I went to Brussels, and I'm like, oh, I got us covered, right? Like, this was like 20 years ago or whatever. Like, I took French, so I'm good to go, and I was super not helpful at all. Like, I got there, and the only thing I could figure out is like we were looking at a menu, and I'm like, that's the word for like head, like a head of something. Like, that's not like something we normally eat. But yeah, so anyway, I suck at French. It's bad, and I'm sorry, Precious or La Pierre. I'm sorry, but you win. So email support@leveluprn.com, and we will get out a Nurse Squad game for you of your choice. Yes. So congrats.
This is a great question and very astute observation. Like, you are on it. I'm very impressed. We changed time because my children are growing up, and now their bedtime falls in the 8 p.m. plus hour. And so from 8 to 9 would have been directly during bedtime for me. So yes, I'm sorry, but
oh yeah,
growing up.
I know. Yep. Okay. So we're just like keeping it flexible, and yeah. So as Meris's kids get even older, we might have to adjust again. My kids are like adults and out of the house, so I can do this whenever. All right. Yeah. Let's see. Is it my turn to ask you a question? Yep. Okay. Oh, you know what? I think it might be time for a hazard card. Okay. Yep. Hazard card. So you know what that means, Team Meris? It means that you have to answer the next question correctly, or you lose 4 points.
I should use that hazard card before that Finnegan question.
Oh, dude, we would have been so like, yeah, that would not have been good. That would have been not good. Okay. All right. So this is family on the phone. This is the hazard card. Your patient's family calls a lot. They must really love him because this is the fourth update they've requested in the last 6 hours. Hard to get your other work done when the phone keeps ringing. That is a thing.
That is what it feels like. That is it.
Totally. Okay. You ready?
We're ready.
You ready? Okay. This is a 2-point med-surg musculoskeletal system question.
Okay.
Name 3 symptoms of compartment syndrome. 3 symptoms of compartment syndrome.
There's more than 3. So
okay, you can hit my timer. Hit the timer.
Oh yeah, sorry.
Thanks.
So just start typing them. You don't have to get all of them. Just start putting them in the comments. We'll keep track. So yes, compartment syndrome. Paresthesia, yes.
Okay.
Pain,
Yeah.
swelling. I'll take swelling.
Pain. Yeah. So you have
Yeah.
3. I mean.
Oh, I forgot we weren't trying to name all 5 of them. Sorry.
No. You got
Yes.
3. So
Pallor,
when
pain.
someone.
Yes. Oh my God.
Yep. Nice job. Yeah. 6 P's, right? So we've got like paresthesia, paralysis, pallor, pulselessness, as well as a hard and swollen muscle. So no bonus points, but just bonus question. What is the treatment for compartment syndrome? How do we treat compartment syndrome?
It's real gross.
It's gnarly, and they get to see me, wound nurse, after they get this done.
Yeah. I'm there for the event, and Cathy is there for the cleanup.
Oh man, you're like, they just do it right there on the spot in the ER room.
Gross. I've seen it one time, and it was disgusting.
They don't take them to the OR.
No, not when we had one that was like too far gone, and they did it in the trauma bay, and it was real gross.
Oh, yeah. So you just slice right into that muscle compartment, and it like opens that whole leg up.
Fillet you like a fillet. They just let you just. Oh, it's so gross, but it's better than losing your limb. Like,
correct.
You can heal that wound. Yeah.
Totally. And then they usually get like a wound vac, at least at my hospital. A lot of times they get a wound vac, and then I come and do the wound vac dressing changes.
When I was in nursing school, my patho and med-surg professor, she always shared a story in her classes because her sister broke her femur, ended up in the hospital, had a cast applied to her leg, and both of them are nurses, and had ended up with compartment syndrome and getting a fasciotomy. And she always showed us pictures of her sister's like scar and everything. Like, it was really gross. So yeah, and it was like the whole length of her leg, basically. Like, it was. Oh,
they had to like go away. Oh wow.
Yeah, it was like the whole compartment. Yeah. But the compartment surrounding your muscle, right, is, I think of it very similar to your brain, right? We can't tolerate a lot of swelling. So just in the brain, if I get just this little bit of swelling, I'm in big trouble, right? There's nowhere for that brain to go when it's swollen. And same thing with compartment syndrome. That muscle is wrapped into a compartment.
Fascia.
It is in that fascial layer, and it is in a compartment, and it can swell a little bit, but that fascia is not really elastic and forgiving. It's tightly bound, and so that swelling has nowhere to go.
Right. So basically it collapses the blood vessels, right? Like, it just, everything gets collapsed because of that swelling. So
yep.
Okay. Well, you guys did not end up losing 4 points, so congratulations on that.
Thank you.
But you don't get any points on that. But now it's your turn to answer a question again.
That's right.
Yeah. Yep. All right. So, Team Meris, you now have a pediatric renal system 2 points. All right. This is a good one. Frothy urine and massive proteinuria are classic signs for which condition? So frothy urine and protein in the urine.
And if you are big fans of our cards, then you know my favorite way to remember this, that frothy part matters.
Yes. So maybe someone who has our cards can tell us our little cool chicken hint for this.
So you've got to be able to interpret those results, right? You got to be able to identify the difference between some findings in the urine versus other. So, oh my God, yes.
Oh,
you got it.
Okay, good. Okay,
Nephrotic syndrome.
Okay, yep.
So
have to know what we're go ahead.
You are so smart, by the way, for thinking preeclampsia, because protein in the urine is also a classic sign for preeclampsia. So that's like very good looking out. In peds, however, what we're talking about is nephrotic syndrome. And the way that I remembered this in school is that it's nephropathy syndrome, right? Frothy urine is caused by that massive proteinuria. When we are passing that protein into the urine, it creates that frothy appearance. So it's nephropathy syndrome.
Yep. All right.
Yes, CD, that sure was Team Cathy answering that question for Team Meris. Thanks a lot for that.
Oh man, who did it?
Several people actually.
Oh my God, Team Cathy. If you are A through L. Okay. Nephropathy. Yeah, nephrotic syndrome. Awesome.
Yep.
Okay, we're ready for our question.
All right, so 2-point respiratory system question from the Med-Surg deck. And this is one of my favorite things of all time. So I've definitely made a TikTok video about this before. Which elevated lab value indicates to the nurse that there may be a blood clot in the body? Which elevated lab value indicates the possible presence of a blood clot?
Okay, what lab value may be elevated when we have a blood clot? And then if this lab value is not elevated, oh, there it is, D-dimer.
D-dimer. So fast. Yes. D-dimer is produced by the formation of a clot. And so anytime your body forms a clot, it releases D-dimer. It doesn't tell us, now, other things can release D-dimer, so it is not a specific lab. It tells us that we need to suspect a blood clot, but many other things can do that. If you touch me, I bruise like a peach, right? And so every time I go and I get a D-dimer drawn, it's always elevated because I'm covered in bruises at all time because I have problems with my connective tissue. Large bruises can elevate the D-dimer. So it doesn't mean, yes, there is. It means there might be. So other things can cause that, like cancer can cause an elevated D-dimer. There's all kinds of stuff, but it tells us you need to investigate further. So my patient who's having chest pain and shortness of breath and an elevated D-dimer, we're going for the spiral CT to make sure you don't have a pulmonary embolism, my friends.
Right. But if D-dimer is not elevated, if it is negative, then that rules out the possibility that it's very unlikely that the patient has a blood clot.
Yes.
So if we have a patient with a DVT, we're going to check that D-dimer. What's another diagnostic tool we're going to use? What's another type of imaging thing we're going to do with somebody who has a
specifically
for a DVT? Yeah, for a DVT, where would we send that patient? What would they get done? And that's going to happen a lot if you work on a med-surg floor and probably in the ER. Like you're going to be sending patients there all the time.
Yes, for an ultrasound. Yes,
that's right.
So specific
venous. Yeah, so venous duplex ultrasound is what they're going to have done.
Yes.
So the D-dimer and that venous duplex ultrasound are like two key diagnostic studies for suspected DVT. Okay.
And then if we have that, if it comes back and we sure do have a DVT, you better believe that we might be investigating further with a CT of the chest also to ensure that we haven't had clots break off and find their way into our lungs, right? So you will see all of that. So to the people saying CT, you're also correct. That's just more diagnostic for pulmonary embolism and not DVT.
Well, you just totally stole my next question. Okay,
oh, no!
That's fine. That's all right. So the next question, which I'm not going to ask because a patient with a DVT reports new onset chest pain and shortness of breath. What complication does the nurse suspect? So pulmonary embolism. I know, right? Okay. So instead, I am going to ask a med-surg renal system 2-point question for Team Meris. All right, you guys ready? And you got the little timer for me. Sorry, I'm being lame and making you do timers on, but okay. Name two. Okay, first of all, if Team Cathy, do not answer this question. So if you are A through L, do not answer this question. You can say it to yourself, like, oh, this is the answer, and then you can wait, okay? All right, name 2 electrolytes patients with acute kidney injury or chronic kidney disease should restrict in their diet. Super testable stuff here. 2 electrolytes that someone with AKI or CKD should restrict in their diet.
Oh, God. Listen, there's one that should come to your mind. Yeah, there's one that should come to your mind immediately. Absolutely.
All right, you got it. Yep. Okay, so yeah, totally. So they should restrict potassium, sodium, phosphate, and magnesium. So nice job. Nice job. Primarily the first 3. But
that potassium, and the way that you can remember is those patients who miss their dialysis appointments, right? If I have a patient who misses dialysis, the number one thing I'm concerned about is that they are hyperkalemic. Almost always that's when I'm getting my critical potassiums of 7, 7.2, whatever, like the really, really high scary ones. So yes, absolutely. If we restrict that intake, hopefully we can restrict the amount that it builds up in a patient with CKD.
Okay. So before we go on to the next question, let's have, for people who are interested, our next giveaway, and this is a big giveaway, is a free year of membership. Okay.
1 year, a whole year.
Yep. And it's a $99 value, because normally it's $10 a month or it's $99 for a year. And you get all of the things that we talked about at the beginning of the video, all of our ad-free core content videos. You get our dosage calculation course. You get over 1,000 review questions. You get our cram courses, which are gold.
You get a discount, by the way. Did you know that? We didn't say that at the beginning. You get a discount on anything that you buy. As long as you're logged in. You have to log into your membership and then go to the Level Up RN website, add whatever it is that you want to your cart, and there's a discount for site members. So, I mean, this is great.
Totally. Okay. So if you want to enter one time only and put in the comments, free year, please. And you have to put the please because you have to be polite. Okay? Free year, please.
Please.
Okay. Free year, please. And you guys enter while we'll keep playing. And then, and you got to hit that like button too. Because Angelina's not even going to process this stuff at all.
She's going to flip through a magazine or something until you guys get the numbers off.
Totally. So if you want to win, if you are enjoying this video, if you are learning stuff, then hit that like button for sure. Okay. Free year, please, if you want to win. Yep. It's my turn. Yep. It's Team Cathy. Okay. So A through L, it's our moment.
I'm taking it easy on you guys with a 1 point endocrine section question. And I tell you, y'all, this is easy money on the table with this question. All right. At which time of day should a patient take levothyroxine? Which time of day are we taking levothyroxine?
Okay. When are we given our thyroid hormone replacement medication?
In the AM. I knew it. I knew this was going to be a quick answer.
Totally. It's in the morning and it's before breakfast, right?
Yes.
And we want to give it with a full glass of water before breakfast. So at my hospital, patients who get levothyroxine, they are scheduled for 6 a.m., right? So at 6 a.m., I know. I wake them up.
I think it's 7 at my hospital. That's so early.
Yeah, it's kind of sucky. And so I'm like, you know what? You need labs too. I don't let the lab people in until I'm there with the thyroid meds. So we're just going to do it all together. Yep. And then I got the CNA ready to do the vitals too. So I'm like, okay, we can all go in.
Cluster care.
Get everything done at 6 a.m. and then you can try to go back to sleep. Okay. So, right. So before breakfast, full glass of water, about 30 to 45 minutes before breakfast. Okay. Good job. So smart. Okay, this is super heavily tested on. This is a pediatrics nervous system 2-point question. You guys ready? Which vaccine is commonly given to college students who will be living in a dorm?
Oh man.
Yeah, so for sure, before I sent my kids off to college, they got this vaccine. It's a thing and it's important. And it is tested on in nursing school heavily.
Yes, and in many places you cannot live in the dorm unless you have had this vaccine because it is for such a serious reason. Meningitis. There we go. Not MMR, but that's a very good guess. Yes.
Yeah, meningococcal vaccine. So it's at least when my kids did. I mean, they're always adjusting vaccines a little bit over time. It was a 2-part. There was like meningitis A and B. There was like, they had to get like a couple different ones.
Yeah, I remember being really annoyed because I don't remember most of my shots, like, because, from when I was a baby or whatever, and then being like, man, I have to go get this series of shots and I'm 17 years old. Like, and I was really mad about it. But yes, it is so highly transmissible in areas where you are living together. This is why when we have somebody with meningitis, even suspected meningitis, they are put in isolation, right? Because it spreads like crazy. And also, who's not really good at keeping their germs to themselves is teenagers. Like, they're not like, they're all drinking after each other and sharing cups and making out with each other and stuff, and they're just swapping their germs. It's gross. Yeah.
Well, and here's the other thing about dorms. Like, so my daughter was in a dorm with so she was in a triple, so she had 2 roommates. And it's one of those traditional style dorms where they have like the rooms and then the bathroom down the hall. So there's no sink or anywhere for them to wash hands in their bedroom or anything. So they have to, go down. Yeah. So everybody's touching everything, and, they can wash their hands in the bathroom and stuff, but like, there's nothing like that in their bedroom,
We need to get college students foaming in and out of their rooms. Like, oh, it's so gross.
Totally. Yeah. No, I mean, it took exactly 2 weeks for Sarah, my daughter, to get like super, super sick in school because it's just an incubator.
Pneumonia. I got pneumonia the first week of school. The very first week of college experience, I ended up having to get my RA to drive me to an urgent care because I didn't have a car. I didn't know where an urgent care was. I didn't know anybody to give me a ride. My RA took me to the urgent care and I had pneumonia.
Oh my God. So what's another type of environment besides like a dorm where it would be important for someone to get this kind of vaccine, to get a meningitis vaccine? What's another kind of situation, housing environment that would require that?
We give them protection against pneumonia as well. Oh, prison.
Yep, prison.
Yeah,
that's a good one.
That's not even what I was thinking, but that's a great one. Shelters, absolutely. A domestic violence or a houselessness shelter, absolutely. This is what I was thinking. Yes, I was thinking of a nursing home, an ECF, something like that. Yeah.
I was thinking military base. Yep. Those
are like all hospital workers. Yeah.
Totally.
Especially in the ER, this is one of my things that makes me terrified all the time is I don't know you have meningitis, right? You just walked in the door and you've got a high fever and your neck hurts, right? I don't know that you have meningitis. You might, but now you've been breathing right in my face, so we'll find out.
Totally. Okay. Who are we even on like the number of questions? 1, 2, 3, 4, 5, 6, 7, 8.
You asked me. I think I have to ask you one.
Okay, you have to ask us one still.
Yes.
Okay. All right. So we'll do that, and then we'll announce our winner after that. Okay.
Yep. All right. Describe the. Oh, sorry. This is a 2-point health assessment question. Describe what is meant by the term borborygmus when auscultating a patient's bowel sounds. Describe what is meant by the term borborygmus.
All right.
When auscultating
fancy name, but it's pretty straightforward what this means.
I gave you all the information.
Medical, medicine.
Sound.
They got to name basic things.
This was my dad's favorite word. My dad was an OB-GYN, and this was his favorite word.
Yep, hyperactive bowel sounds.
Hyperactive bowel sounds is exactly right. So when you're sitting there and you hear those bowel sounds, like you just touch that stethoscope to their skin and it is just through the roof. Hello, baby. then it is borborygmus.
You got a kiddo here?
Yes.
I've got my mom over here somewhere. Hey, Mom, you want to come say hi?
Are you being shy now?
Maybe she's not here.
Okay, I love you.
Oh yeah, my mom. So my mom's gonna come say hi too. Your kiddo's so cute.
Oh, is he?
All right. My mom is in one of my TikToks. Are you guys familiar with the whole? You are famous, and your arthritis finger too. Remember that's famous too. Here, come over here. This is my mom. I'm visiting.
And,
oh my gosh, I was so excited.
My arthritis finger, she writes about.
They're very famous.
Video on this guy, yeah. So
Yeah,
just...
I can't get anything else wrong because she'll show it off on the screen.
Totally.
Okay. Oh my gosh.
All right, so hope you all enjoyed these little guest appearances tonight. Meris, so we have a winner now.
Yep, that's right. What is it? Who is it?
I'm gonna let you do this one. How's that?
Oh yes, sorry. I'm copying pasting. Sorry.
Oh, hey, I'll say hi to Mom. So.
Okay, so our winner of the 1 year of our membership. Wow, I totally blanked on what we were doing. I was like, they got a year of something. 1 year of the Level Up RN site membership is going to be Andres TM. So send us an email at support@leveluprn.com. And then that way you can claim your free year of membership and see all these super awesome things that it has to offer.
Totally. And as a reminder, again, if you guys enjoyed tonight, if you want us to do more of these sessions and you're learning stuff, then definitely make sure to like the video and definitely stay tuned for, I don't know, do we have the date on our next one yet or not quite yet?
Yes. Wait, I believe we do because I remember thinking, wow, that's far out in the future. Yes, July 19th, Wednesday, July 19th at the same time. So it's going to be 7 p.m. Eastern time. That's 4 p.m. Pacific for all of you West Coasters. So, and then everywhere in between. Yes, so that will be Wednesday, July 19th is our next one.
All right. So, and Game Bread, this is exciting. I'm starting my pre-nursing classes this fall and I've been self-studying to prepare for college. Okay. Overachiever, that's awesome. Get an early start. You're going to do great. Awesome. So glad that you joined us and it's really going to help you a lot. So, yeah. All right. So glad this was helpful, guys.
Wait, we got to count. You got to count.
Oh, we almost left without counting.
For the second time. Yeah.
Okay. All right. Here we go. 4, 6, 8, 10, 15, 17 points you guys got.
That can't be right because you only got 11.
Well, we did like the whole hazard thing. Well, we didn't get that crazy maternity question. And then we played a hazard. Okay. Oh no.
Pardon me, I just need to break out the collection.
Right. So for some reason Meris has like, how many trophies do you have over there?
I have 3 actually.
Yeah. Okay.
It's because my children keep giving me trophies because for this, this is my super mom trophy. And this one my husband got me, it says, congrats on adulting. And I think this was when I got into nursing school or something. So yes. And then I got
congrats on does it actually say congrats on adulting? Okay, sure, that's amazing.
Oh,
yes. I'm putting it on you know what? I'm putting it on my wish list right now.
It's so good. It's solid. This is my favorite one. Yeah. I love my Supermom one, but I like being recognized when I do adult things like get dressed and go to work and pay bills. Like I did it. I did the things. I'm so proud of myself.
Yeah. It's I try to when I want something, I'm gonna put it's on my Christmas list.
Oh, I've got a list 1 and 2. Yep, absolutely right. Okay. Yep. So yes, and then I got yet another one from my kids for my birthday this year. So I got to find that one and bring into this room because I'm really I need a trophy room at this point because it's getting excessive.
Yeah. All right. So congratulations to Team Meris. Team Cathy, you guys did amazing as well. And honestly, everybody wins because we all learn stuff, especially that
Finnegan, yeah. Oh, don't you worry. Team Cathy has a trophy. Team Cathy has a trophy.
Oh yeah. No. Well, and last time, I think I showed my little hand trophy. I do have a pretty amazing trophy. I do have an amazing trophy.
And she actually won it versus just being somebody's mom and doing it pretty okay. She actually deserves her trophy. So yes, it's awesome.
Totally. All right, guys, you guys have a great evening. And if you've got your NCLEX coming up, then good luck. And we will see you next time. Thank you so much for joining.
Bye, guys.
Bye.